Hello, everyone. Today, I'm going to share an incredible story with you. Have you ever thought of diabetes medication as a lifelong shackle? Well, there are people, even to the surprise of doctors, who have stopped their meds and still maintain normal blood sugar. Today, we'll dive deep into real life examples and uncover the common secrets shared by those who succeeded. But first, an important note: never stop your medication without consulting your doctor. This video is for informational purposes only, and all treatment decisions must be made after consulting a healthcare professional. Let's start with a shocking statistic. The DIRECT study in the UK found that 46% of type 2 diabetes patients could maintain normal blood sugar without medication. Even after 2 years, 36% were still off meds with normal levels. Since 2021, the American Diabetes Association has officially recognized the concept of diabetes remission. This is defined as maintaining an HbA1c below 6.5% for at least 3 months without medication. This alone shows that quitting diabetes meds isn't impossible. So let's hear from people who've succeeded. Our first case is Mr. Kim, a man in his 50s who took diabetes medication for 5 years. Through an extreme low-carb diet and intermittent fasting, he stopped his meds in just 8 months and has maintained an HbA1c of 5.8% for 2 years without them. The second is Ms. Park, a woman in her 60s. She lost 15 kilos and incorporated regular exercise, quitting medication after a year. She credits her success to a 30-minute walk after every meal. The third is Mr. Lee, a man in his 40s. After his diabetes diagnosis, he focused on lifestyle changes and stopped medication within 6 months. High-intensity interval training 5 times a week and a complete diet overhaul were key. Analyzing these success stories reveals common threads. The first is weight loss. Most lost over 10% of their body weight, especially abdominal fat, a major cause of insulin resistance. Research shows that people who lost 15 kilo or more achieved remission in 86% of cases, while those losing less than 5 kilograms succeeded in only 7%. That difference is astonishing. The second common factor is carbohydrate restriction. Most limited intake to 50-100 grain daily, completely avoiding refined carbs and simple sugars. However, this can cause severe hypoglycemia, especially for those on insulin or certain meds, so it must be done gradually with the doctor's guidance and dosage adjustments. The key here isn't just cutting carbs, but replacing them with healthy fats and proteins, avocados, nuts, fish, and olive oil to maintain satiety, which proved crucial for success. The third is intermittent fasting. Many use the 16-8 method, 16 hours fasting, 8 hours eating, improving insulin sensitivity, and giving the pancreas a rest to aid recovery. Some went further with the 52 method, 500 calories on 2 days a week, or even medically supervised extended fasts. The fourth is high-intensity exercise. Beyond just walking, they combined strength training and HIIT. Increased muscle mass boosts glucose use, aiding blood sugar control. Post-meal exercise was particularly effective. Studies show a light walk or squats within 30 minutes of eating can dramatically, or by over half, reduce blood sugar spikes, a principle most followed diligently. The fifth is stress management. Chronic stress raises cortisol, increasing blood sugar. Successful individuals used meditation, yoga, or hobbies to manage it effectively. The sixth is adequate sleep. As discussed in a previous video, sleep deprivation hampers blood sugar control. These people ensured 7 to 8 hours of quality sleep nightly. The seventh is blood sugar monitoring. Using continuous glucose monitors or glucometers, they tracked real-time changes to adjust diet and exercise, identifying which foods spiked their levels and when to exercise. The eighth is close collaboration with healthcare professionals. They worked systematically with endocrinologists, dietitians, and exercise specialists, ensuring safety through regular checkups. The ninth is a gradual approach. They didn't overhaul everything at once, but progressed step by step, cutting sugar in month 1, starting exercise in month 2, and adding intermittent fasting in month 3. The 10th is strong motivation and willpower. Most were driven by family or a personal brush with severe complications, fueled by a desperate, I must do this mindset rather than a casual let's try. Who's more likely to succeed? First, those diagnosed within 5 years, as pancreatic beta cell function is often still intact. Even those with 10-20 years of diabetes have succeeded, so don't give up. Second, those with higher C-peptide levels, indicating better insulin secretion capacity. Check this with a blood test and consult your doctor. Third, obese individuals often had higher success rates since weight loss significantly improves insulin resistance. Lean diabetics, where insulin secretion itself is impaired, may find it harder as weight loss benefits are limited. For them, preserving pancreatic function and maximizing insulin secretion should guide their strategy. Fourth, those with strong motivation. Completely changing habits is tough, and without persistent drive, it's easy to quit. But a crucial point, not all diabetes patients can stop meds. Type 1 diabetics need insulin, and some type 2 patients with severely damaged pancreases may struggle. Stopping meds doesn't mean a cure, it's remission, and poor lifestyle habits can trigger a relapse. Lifelong management is essential. Even after quitting, regular checkups are a must. HbA1c every 3 months, comprehensive exams every 6 months. If blood sugar rises, resume treatment immediately. How to start? First, consult your doctor to assess current meds, complications, and overall health. Second, create a structured plan, set weight goals, diet, exercise, and monitoring methods. Seek help from dietitians or exercise specialists. Third, start slowly. Sudden changes can strain your body, especially with insulin risks, so proceed cautiously. Fourth, monitor consistently. Track blood sugar in real time. To adjust your plan and consider a continuous glucose monitor. Fifth, don't give up. Blood sugar may not drop immediately, but persistence pays off. Many see sudden improvements after months. Learn from failures too. The most common pitfall is rushing abruptly. Stopping meds or starting extreme diets can be dangerous. Another is going solo. Relying only on internet info without medical guidance risks emergencies like hypoglycemia or ketoacidosis. Third, depending on temporary enthusiasm often leads to early dropout. Focus on a sustainable long-term plan. Fourth, perfectionism. Don't quit over a day or two of mistakes. 80% success is still meaningful. Successful people also had family or community support. It's tough to manage diet and exercise alone. Family eating healthy or exercising together boosts success. Networks with like-minded individuals online or offline help share info and maintain motivation. A key point, quitting meds shouldn't be the goal, living healthily should. Even reducing from 3 meds to 1 or having insulin doses improves quality of life and lowers side effect risks. Advancements offer more options. GLP-1 agonists aid weight loss and blood sugar control, enabling lifestyle changes to phase out meds. Metabolic surgery, like gastric bypass or sleeve gastrectomy, is an option too. Studies show over 80% of obese diabetics quit meds post-surgery. Post-remission cautions never get. Complacent remission isn't a cure and relapse is possible. Continue regular checkups, blood sugar, blood pressure, cholesterol, kidney function, and eye exams to catch other chronic conditions. Maintain healthy habits, lifelong reverting to old ways. Risks diabetes returning, this is the hardest part. Finally, a hopeful message: quitting diabetes meds isn't impossible. It's challenging, but with willpower, the right approach, and medical support, it's achievable. Focus on gradual improvement, not perfection. Even reducing meds or preventing complications is a big win. Diabetes isn't incurable. With proactive management, you can live normally and, in some cases, reach remission. Start with small changes. Today, don't overhaul everything at once, but improve step by step. Consult your doctor and proceed safely. I hope this video offers hope to those struggling with diabetes. I'll return with more helpful info next time. Stay healthy.